This is Kia Sanford. I'm clinical nutritionist and counselor, and this is installment number 2 of my video blog about shoulder surgery. Well, it may actually end up being more about something else this time. Interestingly enough, after ensuring that my surgeon was in fact in network in my insurance company and going through the whole preparation for, well, evaluation for starters, and then the preparation for surgery, I made an extra call because I just had this little niggling feeling in the back of my mind that something wasn't quite right. So I called the surgery center where he performs his surgeries, and I said, oh yeah, oh absolutely, you're in net, it's covered, we'll bill the insurance, your total out of pocket is going to be X amount of dollars. And I still thought, something sounds off. So I called my insurance company. It took me about 4 days to get through to them, thanks to all this new changeover in insurance and everybody's got mess ups going on left and right. So I called them, and after being on hold for about 45 minutes for the second time, they said, in fact, the surgery center that my surgeon practiced out of was billable, but they were not in network, meaning that it would be an out-of-network expense, and there is a different deductible for the out-of-network. So what ended up happening was, after I did the research, it looked like that surgery was going to be paid for out of pocket, essentially, by me. And there was no way I was going to be able to afford that. So I talked to the insurance company further and said, well, can you check the other places where he operates to see if we can find a different center, a different place, different hospital? Interestingly enough, none of them were in network. The surgeon is in network, but none of the places he operates are in network. Yeah. So, long story short, I have to start from square one again and canceled that surgery. I've started with a new surgeon who evaluated me this week and gave me a completely different diagnosis. So now I'm frustrated, in pain, and confused. So this surgeon is in network, and I did my homework ahead of time. All the places that he operates are in network if we need to go there. He said that no, it's not a slap tear, in his opinion. It is adhesive capsulitis, or what's commonly known as frozen shoulder, which is rather radically different when it comes to just the diagnosis itself, but certainly the treatment for it. His recommendation was very adamant. I must get started immediately on very aggressive PT. And then we'll schedule an MRI, and we're going to schedule another cortisone injection. I've already had one. So I left the office again feeling a little more confused than ever, but I decided that what I've been able to discover about adhesive capsulitis and my experience don't necessarily fit all that well. So rather than jumping right into aggressive PT, I decided on my own I was going to wait until after the MRI results came back before getting started with that, just in case there's some underlying issue that aggressive physical therapy would actually make worse instead of better. So that is scheduled for next Tuesday, after which I have the following Monday a follow-up appointment with this surgeon to go over what the plan of action is, and he wants to schedule that second cortisone injection. Well, the research that I've done about cortisone injections does not lead me to be all of that interested in a second one in 1 month. So I intend to decline that offer and the expense, and go with it's actually feeling like I can move it now in some minimal ranges of motion that I can get through my day thanks to that first cortisone injection. So I think it's working. I don't think I want to run the risk of joint degeneration by too much corticosteroid injection. So I'm in limbo still and waiting for the results of the MRI. I'm hoping to get those very soon after the scans are done. So I'll check in then. In the meantime, little piece of advice, even if you think you're covered, even if the office says you are, call your insurance, double, triple, quadruple check, make sure that you're covered. And that's not just the surgeon and the surgery center or the hospital. That's also your anesthesiologist, any medical equipment that you might end up having to get, physical therapy, nursing help, caregivers, any of that stuff that you plan on running through your insurance, make sure it's covered. All right, take care. I'll talk to you soon.